We're continuing on with our first day of life series here on the Second Opinion Pod with Dr. Dua Hassan. Dr. Dua is a physician, a pediatric physician at the Boston Children's Hospital and a former Stanford University of Medicine instructor. And today we're going to talk about hepatitis B, which I think is one of our more potentially controversial parts of the first day of life. So, Dr. Dua, tell us about the hepatitis B vaccine.
Yes. Yeah, James, I'm really excited to be here and talk with you about the hepatitis B vaccine. And it is right now a very controversial topic, in part because the CDC very recently made changes to the childhood vaccination recommendations. And for the first time in decades, certainly in the first time since I've been practicing medicine, it is no longer universally recommended at birth for all newborns. And this has been, every pediatrician has been talking about it. Well, not really, but a lot of them have been talking about it. And it's something that is definitely many doctors agree with and also many disagree with. It's definitely a change from the previous recommendations.
So before we talk about the controversy, can you set the scene for us and just kind of like, what is the vaccine? What was the old standard? Like, let's like actually get specific about how things used to work, and then we can talk about changes and like why one might do that. But like, let's start with the facts.
Yeah, so hepatitis is a medical word that just means inflammation of the liver. So every time you hear the word hepatitis, it means that something's going on with the liver. And there can be many different things that cause inflammation of the liver. There could be alcoholic hepatitis, for instance. And so when we talk about the various hepatitis viruses, we're talking about viruses that cause inflammation of the liver. And there are many hepatitis viruses. It probably sounds like an alphabet. There's hepatitis A, B, C, E. But for our purposes, hepatitis B in particular is generally spread through blood and body fluids, and it has a high rate of chronic infection in infants if they get it. This is in contrast to, say, like hepatitis C, which is stereotypically associated with older individuals. There's a stereotype that it's like a lot of boomers end up having hepatitis C because they used to do like, different needle sharing of drugs back in like the Woodstock days. That's like used to be a classic board question. But for hepatitis C, there is no vaccine. So there's really no options if you contract it. And then hepatitis A, another hepatitis that is usually fecal oral, is kind of associated a lot of the times with the developing world. That we also have a vaccine for that we give kids later on.
Okay, and so hepatitis B, why did we start doing the vaccine on the first day? Like, why has that been the protocol?
Yeah, so it's, in the announcement, in one of Trump's, I should say, he's had many health announcements. In one of Trump's health announcements, he mentioned that hepatitis B is a sexually transmitted disease. And so why are we giving it to babies? And that is true in the adult population, but that's actually not true for children. In babies, hepatitis B is almost always transmitted perinatally, which means from mom to baby during delivery. And that's why after the baby is born, right after delivery, they just went through the highest risk activity that would cause them to have hepatitis B. And that's why we think about it in that window. And another difference between kids and adults is that adults, they have stronger immune systems. So when they get a hepatitis B infection, most adults actually can clear the infection on their own. That's in contrast to a baby. Babies actually they're much more sensitive to infections because their immune systems are still developing. In fact, one of the things that protects babies is getting immunoglobulins, IgG, from mom. So breastfeeding is one of the ways that babies enhance their immune system. That's how weak their immune systems are, if you will. And so in babies, the overwhelming majority, about 90% who get hepatitis B or get exposed to hepatitis B, develop a chronic hepatitis, a chronic infection or inflammation of the liver.
Yeah. This is going to be a stupid question, but I'm going to ask it anyway. When you say a chronic infection, that's an infection that never goes away. That's one that like you just can't get rid of, causes you problems for the rest of your life.
Yes, exactly. And when it comes to the liver in particular, that can cause dysfunction of the liver. We call that cirrhosis. And then eventually in patients, if the cirrhosis gets bad enough, it turns into liver failure or particular types of cancer called hepatocellular carcinoma, certain cancers of the liver.
Got it. And then another stupid question here. Does it become chronic immediately if the baby has it? I'm just trying to understand how all of this works?
Yeah, you're asking a really good question. And the answer to that question is when it comes to hepatitis and the hepatitis viruses, whether it's A, B, or C, prevention works much better than any of the therapies that we have.
Got it. So, okay. So then the old recommendation was, or the old protocol was to do the hepatitis B vaccine actually pretty quickly after birth for every single child in every single circumstance. What is the new world going to look like? How does this compare to, and I guess, how does this compare to other countries?
Yeah, so as I mentioned, most hepatitis B is perinatally transmitted from
Hmm.
mom to baby during delivery. One thing that we have introduced in the last several decades, in addition to the vaccine, is we now universally screen mothers during pregnancy. And so because we screen mothers during pregnancy, the question arises if I am pregnant with a baby and I screen negative for hepatitis B, I was vaccinated as a child for hepatitis B, and I've
Hmm.
never screened positive for hepatitis B. Why does my baby need the vaccine on day of life 1 or 2? And so
Hmm.
that's actually part of the reason why that recommendation, the people on the opposing side, why they felt like they no longer wanted to universally recommend the vaccine right after birth.
Got it. Got it. And then what are the downsides of having the vaccine? Is it risky in any way? Is it just the discomfort of, you've got a baby that is, new in the world and you got to poke it? Yeah, what's
Yeah, for vaccines, the side effects or potential side effects are all very similar. There can be some erythema, swelling, pain at the injection site, the site where
Mm,
we give the shot.
mm,
And then there's always a very small but possible risk of anaphylaxis. Very, very rare condition that can happen in theory from vaccines. It's not something that I've ever seen clinically, but is always a risk.
mm,
But I think the more important question actually is that whenever you have a medical intervention,
mm,
regardless of the potential for harm, you want to make sure that there is a high enough upside. And so I think the people who are opposed to the vaccine are essentially saying if mom is screening negative for the vaccine, what is the upside to giving, sorry, screening negative, I apologize, screening negative for hepatitis B, what is
mm.
the upside of giving the vaccine so early, day of life 1 or 2? Me personally, I personally think that if, and this was the case, this is the case for me with my patients. If mom screens negative, she's low risk, so she's not engaging any high risk activities that would increase her risk for hepatitis B, like, IV drug usage or living in an area where hepatitis B is more prevalent, exactly, which can be the case sometimes in certain, like, if you're homeless and living in certain sheltered situations, that can be the case. But if mom is not high risk and she screens negative, I generally don't press patients if they don't want to get the vaccine. And part of the reason for that is because at the 2 month visit with their pediatrician, they would get the vaccine. So I personally feel if it's a low risk situation, mom screens negative, I don't have a problem with families waiting to delay to get the vaccine until 2 months of age.
That makes a lot of sense. Is this something where in your practice you've seen a lot of people be discomfort, or is this something that is kind of mostly playing out in political sphere above the rest of the population?
I would say of all of the interventions we do early on, this is the one that is most often declined. Many, not the majority, but a sizable minority of people will decline the Hep B vaccine. And they'll get everything else, but that'll be the one thing, well, they'll say, I'm just going to wait until the 2 month visit. And, whenever that happens, again, I sort of very briefly screen mom, look at her chart. If she's low risk and screens negative, I generally don't have a problem with that.
So you were saying that you don't necessarily have to do this vaccine on the first day if if a mother doesn't have risk factors, you're comfortable waiting until 2 months. Is there something magical about the 2 month mark, or like how do you choose that time period?
Yeah, there are some people recommending waiting until 12 years of age. And I would say, as a pediatrician, I would absolutely not do that. There is a big difference between years of age and 2 months of age. I think that in the 2 month of age window, as I mentioned earlier, you're really looking at perinatal transmission. And all of the stuff we mentioned earlier would apply. But as children get older, the different ways in which they get hepatitis B increases. So, for
Mm,
instance, hepatitis B is transmitted between people. We
mm,
call that horizontal transmission. And so, as I mentioned, in the adult population, that is usually sexually transmitted. But
mm,
in kids, it's anything that exposes you to blood and fluids from someone else. So, for
mm,
instance, Imagine your child is 3 and in daycare, and then another kid with hepatitis B comes over and bites them. Very common thing that happens in daycare, and they get bitten really hard and it breaks through the skin. And then that person has hepatitis, that baby has, or that toddler has hepatitis B, and then it can be transmitted to your child. That is a very common situation, getting bitten in daycare. Another thing is, sharing toothbrushes, or, because when you brush your teeth, you get basically microabrasions. So sharing toothbrushes can be a high-risk activity if someone has hepatitis B. So as kids get older, the ways in which they could get exposed increases. And so it's sort of like you're really gambling then, in my opinion. You're basically saying, you're sort of gambling. Whereas in that, early 2-month window, again, in a situation where mom is negative, baby's in a very safe environment, and it's just with mom, I think it's fine to wait.
Totally makes sense. Tell me a little bit about the prevalent is hepatitis B. How has the vaccine worked or not worked in terms of suppressing it?
Yeah, so before we had these interventions, back in the early 90s or so, the number of babies with hepatitis B in the US was about 18,000. Since we've introduced universal screenings of mom and then the hepatitis B vaccine at day of life 1 or 2, that's gone down by 95%. So the combination of those two interventions is very effective. And that's one of the reasons why, when this new recommendation came out, a lot of doctors and pediatricians were very worried, because we don't want to revert back to that time.
Well, thank you so much for walking us through that and helping us understand the different trade-offs. I know for me personally, when I understand the details behind that go into some of the protocols and some of the trade-offs, I get a lot more comfortable with it. So I appreciate you guiding us through it.
Period.